Hello, my name is Jaquesta Shea Crenshaw, and I am presenting a mixed method mini study on transformational leadership and patient outcomes. This project examines how leadership, particularly transformational leadership, affects the quality of patient care. Transformational leadership is about more than simply managing tasks, it's focused on inspiring motivational and supporting staff in ways that directly influence patient outcome. What makes this study unique is its mixed methods design. It draws both quantitative data such as surveys and mathematical measures and qualitative data such as interviews and personal experiences. The numbers tell us whether leadership has measurable effects, while the stories explain how those effects take place in real healthcare settings. Introducing the key question for this study, which was, does transformational leadership improve patient outcome, and if so, how? To answer this, the research used both numbers and stories. The quantitative data showed measurable links between leadership behaviors and patient outcome. The qualitative interviews added depth, showing how leadership worked in a real practice through staff experience and everyday interaction. By merging these two approaches, the study provided a more complete picture grounded in both evidence and real world experience, making the findings stronger and more meaningful for healthcare leadership. Quantitative findings. The study used two main tools: the multi-factor leadership questionnaire, which surveyed 100 healthcare professionals about leadership behaviors, and also the patient outcome index, which measured how well patients are doing. The results showed that leadership behaviors scored about 3 out of 5, while patients' outcomes scored around 82 out of 100. This suggestion was of results that overall the outcomes were positive. The analysts revealed that transformational leadership explained about 21% of the differences in patients' outcome. Out of all leadership behaviors, two stood out the most: inspirational motivation, which means leaders who inspired the communicative side with a clear vision had the strongest positive impact on care. And number two, individualized consideration, which is where leaders who recognize and support their staff had also made a meaningful difference in the results. Qualitative findings. For this one, the software NVO was used to code 3 leader interviews, combining ideas from existing theories with new insights that merge. For this process, 3 key themes stood out: critical thinking and innovation, where leaders identify barriers and work to encourage new ideas. Number 2, motivation and engagement, where leaders inspired their team with supportive message and emotional encouragement. And 3, role modeling and consistency. Leaders built trust by transparent and leading by example. The findings also showed that shortage of staff and resources influence how leadership apply transformational approaches. In other words, leadership was shaped not only by theory but also by the real challenges within the healthcare system. Next, we focus on merging of the data strands. The study combined both numbers and personal stories to get a fuller picture. The quantitative data showed that individualized consideration and inspirational motivations were linked to better patients' outcome. The qualitative data explained how this happened. Leaders built trust, gave emotional support, and served as role models. Together, these findings highlighted the importance of staff involvement and creativity, showing just how powerful leadership can be. In the end, the interrogation of both types of data makes the results more useful developing hospital leadership programs. Generalization and limitations. The results show that leadership clearly makes a measurable difference, with the regression model explaining 21% of the variations in outcome. However, there are some limitations. Those limitations included the study that relied on self-reporting leadership ratings. Only 3 interviewers were included, so the quantitative sample was very small, and the focus was limited to certain hospital units. Also, on the other end, there was also delimitations, meaning intentionally choices like the scope. For example, the study focused only on transformational leadership and did not examine other leadership styles. Even with these limits, the combination of numbers and personal stories strengthened confidence in the findings. The conclusion. The conclusion has many parts to review, so let's start with reinstating the purpose. In closing, this study set out to explore a central question: does transformation leadership improve patient outcome? And if so, how does this process work? It worked by using a mixed method approach. The study was able to bring together the strengths of both quantitative and qualitative research. Numbers that measure outcomes and narrative that explain the lived experience beyond them. Number 2, the key findings. The quantitative results demonstrated that transformational leadership behaviors accounted for about 21% of the variation in patient's outcome. 2 leadership qualities stood out in particular: inspirational motivation and individualized consideration. On the qualitative side, interviews provided valuable insights into how these qualities functions in practice. Leaders who communicated trust, gave emotional support, and modeled consistent behavior were found to build stronger teams, foster innovation, and enhance patient care. Together, these strands of evidence confirm that transformational leadership plays a real and measurable role in improving healthcare delivery. Number 3, integration of the findings. The integration of both strands, quantitative and qualitative, makes findings stronger. Numbers alone could show how, but not explain why these matter. Stories alone could illustrate experience but not confirm broader patterns. By combining them, the study produced conclusions that are both reliable and meaningful. This shows that leadership influences patient outcome not just in theory but in everyday practices. Staff involvement, creativity, trust, visibility all contribute to creating a positive healthcare environment. This builds confidence that the results are not random, but instead highlighted consistent, impactful relationships between leadership and patient outcome. Number 4, the findings have important implications of healthcare organizations. Leadership development programs should focus on motivational communication and personalized support for staff. By investing in these areas, hospitals and healthcare systems can strengthen both employee engagement and patient results. In other words, leadership is not simply an administration function, it is a clinical driver. When leaders exchange their teams, patients benefit directly. This emphasizes that healthcare institutions must view leadership development as an essential part of improving quality of care. Number 5, limitation and delimitation. Of course, this study had some limitations. It relied on self-reported leadership ratings, which can introduce bias. The qualitative portion was limited to only 3 interviewers, restricting the ability to generalize the results. Context was limited to Pacific hospital units, and additionally, there was also delimitation. The choice to focus solely on transformational leadership, leaving out other leadership style, while this provided clarity, it also means that the finding cannot be applied to leadership broadly without further research. Number 6, further research. Further studies should build on this work by exploring other leadership theories in healthcare settings, using a much larger and more diverse sample, explaining long-term outcomes to see how leadership practice sustains or evolved over time. By broadening scope and depth, researchers can develop a more comprehensive understanding on how leadership shape patient outcome in the long run. And number 7, for the closing statement, I must conclude that the mixed method study confirmed that transformation leadership improves patient outcome and explain how it does it. By inspiring staff, providing individualized support, and modeling consistent, transparent behavior, leaders can create an environment where both healthcare professionals and patients thrive. Ultimately, leadership is not just about management, it is about transformation. And in healthcare, that transformation can be a better experience for staff, higher quality care for patients, and healthier communications overall. Once again, my name is Shay Crenshaw, and I thank you for listening to my presentation.